What I do is a combination of sports medicine and joint replacement surgery. Most of the people that I see have problems with their knees, hips, or sometimes shoulders. That would be arthritis or oftentimes sports-related injuries to the knee or shoulder.
We do treat ankle arthritis, and I am one of the only physicians in the state of New Jersey, especially central New Jersey, that does total ankle replacements. Most patients who do suffer from mid to end stage arthritis in the ankle, it's usually caused by post-traumatic, meaning that they've either sprained their ankle multiple times or fractured their ankle. And by giving them the option of an ankle replacement, we will provide the same pain relief that they would get with an ankle fusion, but they would be able to maintain the range of motion in the ankle.
So in addition to hands, wrists, and elbows, I do specialize in shoulder surgery as well. I perform a number of various procedures for the care of the shoulder, including arthroscopic rotator cuff repair, arthroscopic shoulder stabilization procedures, and various open procedures. I'm currently the only physician in the practice that performs advanced reconstruction for shoulder arthritis and for rotator cuff arthropathy, or for individuals who have bad rotator cuff tears which are not amenable to surgical repair. For those people, we will go ahead and consider replacing the shoulder, either with what we call an anatomic total shoulder replacement or a reverse total shoulder replacement.
The common conditions I treat are typically arthritis. They involve the hip, the knee, the shoulder. I also treat people with back pain, arthritis of the back. I treat people who have injuries, traumatic injuries to the extremities. I do a lot of joint replacements, and I do a lot of shoulder repairs and things like that. A lot of patients come in and they're confused or they don't know what's wrong with them, so I like to give them a plan. I like to organize them in their patient care, and then I like to resolve their issues.
In some cases, all they're looking for is reassurance. In some cases, what they need is advice to do things that they may not want to do, and then in other cases, there may be procedures that are involved. So what I want to do is basically let them know what the options are and give them the opportunity to make the best decision for them.
And once they fully understand, then the next goal that I have is to address their pain and function. And as orthopedists, that's what we work on. We work on pain and function, and sometimes there are non-operative ways to address this, sometimes there are operative ways. Most importantly, we strive to be there every step of the way so that the whole experience is smooth and straightforward.
So over the past 30 years, the length of stay for patients for joint replacements has gone from 20 days to 2 or 3 days. And many younger patients especially don't even need to stay in the hospital. For those patients that are good candidates, an outpatient surgery center provides an area where it allows the patients to get in and out quickly, and they get a lot more personalized care.
Benefits of outpatient joint replacement, I think, are enormous. We are one of the pioneers in outpatient joint replacement in the Delaware Valley. People get better results because they're more active, their therapy is more intensive, their risks are lower, satisfaction rate is much higher.